Hello, I'm Dr. Chidera. Let's talk about the management of irritable bowel syndrome. When confronted with a new diagnosis of IBS, the approach should be personalized based on the individual's symptoms and psychosocial situation. US takeouts include provide a clear explanation of IBS, emphasizing its chronic nature, with recurrent symptoms influenced by the gut-brain axis. Reassure the person that IBS is not associated with an increased risk of cancer or mortality. Explain that the primary goal of management is to improve symptoms and quality of life, recognizing that complete relief may not be achievable. Direct individuals to reliable sources of information and support, such as NHS patient information leaflets and national charities like the IBS network. Provide advice on diet, lifestyle, and mental well-being, including regular meals, a balanced diet, proper fluid intake, and the benefits of regular physical activity. Recommend over-the-counter probiotic supplements for at least 12 weeks for those who choose this option. Encourage individuals to monitor symptoms and schedule a comprehensive review within the next 2 months. Depending on clinical judgment, consider further management options if symptoms persist. Follow-up management of IBS should be individualized. And if symptoms persist despite initial dietary and lifestyle advice, consider the following intervention. If dietary advice is ineffective, consider referral to a specialist dietitian for a detailed assessment, including potential exclusion diets. Explore exclusion diets, such as a trial of a low FODMAP diet, supervised by a trained dietitian. Be cautious of long-term dietary restrictions. If constipation persists, prescribe a bulk-forming laxative, adjusting the dose based on symptom response. For persistent diarrhea, consider prescribing an anti-motility drug like loperamide, adjusting the dose as needed. Address abdominal pain with antispasmodic drugs, such as mebarine hydrochloride, alvarin citrate, or peppermint oil. If ineffective, consider a low-dose tricyclic antidepressant TRO selective serotonin reuptake inhibitor. Refer to mental health services for psychological support if symptoms persist for at least 12 months or if there are psychological comorbidities. Refer to a gastroenterologist if there is uncertainty about the diagnosis, severe or refractory symptoms, or if the person requests a specialist opinion. If persistent or refractory symptoms are observed, consider the possibility of an alternative diagnosis and manage appropriately. Urgently refer to an appropriate specialty using a suspected cancer pathway referral if features raise concern for malignancy. Regularly review the person, adjusting management strategies based on ongoing symptom response and clinical judgment. Consider psychological therapies at an earlier stage if available, and strongly recommend if symptoms remain refractory to drug treatment for 12 months.